Senator from Indiana.
Mr. President, this past Friday marked the 2-year anniversary of the passage of the Affordable Care Act, otherwise known as Obamacare. That bill was signed into law just 2 years ago this last Friday. I wasn't in the Senate at the time. I was actually in the state of Indiana campaigning to be in the Senate as a representative of that state. And as such, I had a very considerable amount of time crisscrossing the state and talking to Hoosiers about the health care plan and their response to what was going on in Congress and to the passage of that law. From small diners and restaurants all across Indiana to visits to small business, large business, medium-sized business, big industrial giants, small mom-and-pop operations, medical providers, ordinary citizens. We in Indiana joined the nearly 2/3, or perhaps even more than the 2/3 of the rest of the country that polled in opposition to the passage of this law. Hoosiers didn't then, and they don't now, want to have a one-size-fits-all nationalized health care system. They want a healthier health care system. They want reforms to the current cost problems and excessive rising costs of health care. And we outlined several of those, and this is really the first of many attempts that I will try to make as we go through the year addressing this plan, which is moving toward ever and ever greater implementation, and particularly kicks in the years following this one. Hoosiers, as I said, did not want the plan then. They don't want it now. They don't want to have federal bureaucrats making their health care decisions for them. They want less government intervention and higher quality of care. And they don't want a health care system that increases costs and premiums while hurting job creators with fines and penalties. They want affordable care and good job opportunities. Now, 2 years after passage of that act, I continue to hear these messages from the people of Indiana and from others, and as we discover more and more information about what is contained in this massive 2,700-page bill that was passed in early 2010. I'd like to just discuss a few of the things of the impacts of this Obamacare law today, and then there'll be more, as I said, more to talk about later. The first is the individual mandate, and of course that's one of the issues the Supreme Court is hearing right now and will be making a determination on. Obamacare is the biggest example of government intrusion in the everyday lives of Americans, whether by forcing individuals to buy health insurance, enacting onerous regulations on small businesses, or by raising taxes and imposing penalties. The health care law forces every American to purchase a health insurance plan, or, if they choose not to do so, to pay the government a fine. This is unprecedented in American history. It is the first time the federal government is forcing citizens to purchase a product or a service that they may or may not want, or, as a consequence of not choosing to do so, pay a fine for their decision to say no. This administration basically is saying to Americans, we know what's better for you than you know for yourself. We know what's better for you than what your doctor suggests is needed. And if you don't get a government-approved health care plan, we're going to assess you with a fine. Now, that is a basic fundamental principle of constitutional law, and the Supreme Court will be making that determination. But I suggest that this Congress needs to continue to debate this and be prepared to act depending on what the Supreme Court decision is, which will come down later, several months from now. The second thing I'd like to talk about briefly is the higher costs that emanate from this particular piece of legislation. In addition to mandating that all Americans have health insurance, the Obamacare hits individuals and families with increased costs and higher premiums. The nation's nonpartisan budget experts at the Congressional Budget Office estimate that when fully implemented, This law will increase insurance premiums on a family policy by an average of $2,100 a year. Therefore, the Affordable Care Act is hardly affordable and increases the already high premiums that people are having to pay for insurance. The President's own chief actuary at the Center for Medicare Services reported that the law will increase national health care costs by $311 billion in the first 10 years alone. Increase is the key word here. Increases the cost by an additional $311 billion. So the goal of reforming the nation's health care system initially was to reduce the skyrocketing costs for Americans, not increase it. And yet we are now being told by the experts and the President's own people that it will increase costs. Secondly, I'd like to talk about the impact of this law on businesses. I talked to dozens, if not hundreds, of businesses across the state of Indiana, both in that campaign year of 2010 and then last year traveling as a senator throughout the state. The President's health care prescription results in bad side effects for American businesses by hitting the very job creators with new taxes and new regulations that they desperately don't need at this point in our struggle to regain economic growth. Take the employer mandate. The law penalizes businesses that do not provide employees with government-approved health care plan. Beginning in 2014, American businesses with more than 50 employees will be fined $2,000 per employee if they do not offer a health insurance plan approved by the federal government. Now, I've talked to a number of business people that have said, look, through painful negotiations with our workers and with our laborers and with our staff, we have put together a health care plan that is accepted both by management and by employees who recognize that if we cannot maintain some semblance of control over our costs, the jobs might not be available in the future because the company cannot afford to keep the people at work. And so in recognition of all this negotiation that goes on and the contractual obligations that both sides work to achieve, understanding that if the business is hit with too much tax and too many regulations, the business may not survive. Those plans now come under the scrutiny of the federal government, and the federal government will determine whether or not those plans are sufficient and adequate. And if it determines that they're not, then a fine is levied against the business. I cannot tell you how many business people told me, look, I will rather pay the fine than have the government impose all these new regulations on us when we are working carefully with each employee to make sure they have their basic insurance needs covered, that as the business grows and profits, we increase the benefits to them. But yet, if we are forced into a set plan of set procedures for every employee, then I have two choices, the business people say. I can either refuse to do so and pay the penalty of about $2,000 per employee, or I can let people go. But bottom line is, if I can't meet my bottom line, I cannot keep these people employed. The arbitrarily fixed basis that small businesses under 50 employees will not be subject to this leaves manufacturers and business people who are slightly below that level, say at the 45 or 40 or 35, a dilemma as they are seeking to expand their business. As soon as I hire number 50, then I'm into the plan, and I don't have the exemption. And so what do? I freeze out hiring more people and look to double up people's salaries or put people on overtime. And at a time when we have over 12 million people looking for a job and about another 11 million people underworked or working 2 and 3 part-time jobs just to make ends meet, we are imposing this law on them. It could not have come at a worse time. And then there's the medical device tax, and this lineup of taxes that is included in this bill that we continue to find more and more of as we read the fine print in the so-called in the 2,700 pages of fine print. Indiana is a state that is home to a lot of medical device manufacturers. In fact, there are over 300 medical device registered manufacturers that employ 20,000 Hoosiers in the state of Indiana, and another 28,000 people that benefit from that employment. There are more than 400,000 workers nationwide by industry. And so what did the Obamacare plan propose? Well, we need some pay-fors. And the pay-fors are that we're going to impose a tax on these medical device manufacturers.
Senator's
President,
time
I
has expired.
sense that I am approaching a deadline in time, and I'm wondering if I could, with the consent of my colleague, ask for 5 more minutes to
Without objection.
I thank you, Mr. President. These medical device manufacturers are employing people that at an average rate of about 41% greater than the average worker rate of pay in my state. And so these are desired jobs. But again, employers and manufacturers of medical devices are telling me they're being forced to go overseas with the burden of regulation and a tax that has nothing to do with the essential program of the healthcare plan. And that's not the only tax. That's not the only tax that is imposed in this law. There are many hidden taxes here that we're just learning about. Let me name just 5. The excise tax on charitable hospitals, the drug industry tax separate from medical device, health insurance industry tax, insurer excise tax, and Blue Cross Blue Shield tax hike. The Joint Committee on Taxation found that the health care law imposes more than $550 billion in new taxes and penalties, most of which will fall on the middle class. Third, the impact on the state of Indiana. Obamacare forces states to expand Medicaid rolls so significantly that it'll be imposed, and this has been talked about earlier today, imposed upon the states in a way that can cripple their ability to try to find some balance in their budgets. In Indiana, where our budget is in far better shape than many other states, we still cannot afford the current Medicaid program, let alone the projected new costs that will be required under the Obamacare law. An outside group has estimated that $3.1 billion in new costs over the next decade will be imposed on Hoosier taxpayers because of this health care law. This added expense does not include any payment relief to providers and therefore shifts the cost to patients by driving up premiums for all Hoosiers. In conclusion, Mr. President, we have to ask the question, what's the remedy for this fatal disease called Obamacare? Well, the remedy may lie with the Supreme Court, and they're hearing arguments on this today and will for the next 2 days. And we'll have a decision by April or June, May or June, on the constitutionality of this law. But it also most likely will end up back here in Congress one way or another. And that leaves us the responsibility of addressing this. From forcing individuals to purchase insurance to taxing successful job creators and burdening state budgets, I believe the health care law is so deeply flawed that it must be scratched and replaced with real reform. Reform that lowers the cost of care, allows the doctor, your doctor, not the government, to decide the kind of medical care you need and provides flexibility to states. Mr. President, real health care reform lowers costs, improves access to quality care, empowers individuals, and preserves personal liberties. And that's not what we have in the law that currently is on the books. So whether through congressional legislation or court action, Obamacare needs to be overturned and replaced with common sense provisions that put patients, not government, not bureaucrats, in charge of health care decisions. Obamacare has proven to be the wrong prescription, and it's time for a new treatment. Americans want reform that remedies our ailing health care system, not one that weakens it and drives it deeper and drives us deeper as a nation into debt. Mr. President, I yield the floor.